And as promised, we're back with Dr. Tim McKnight and Dr. Mike Jakubowski. Good morning, gentlemen. And,
Good morning.
Good morning.
What can you tell us about headaches? It seems like that's something that just about everybody experiences.
It is. And so we figured this would be one that could be beneficial and helpful to the listeners. So what I wanted to talk about as a physician is when somebody comes in the office with a headache, what goes through our minds, what do we need to think about and not miss. And when we're creating a differential diagnosis, which is a list of potential problems as you're listening to the patient talk, we always have to think first, what is the most crucial headache that I can't miss because it could be life-threatening? Well, the first one is a cerebral hemorrhage. And those are classic, worst headache of my life. I mean, holding your head, you're just in severe pain. Those people usually end up in the emergency room pretty quick, and they get a CAT scan, and they're bleeding in their brain. And, a large percentage of the time, people don't survive that. So that's a serious one. Sometimes when it's just starting to leak, you can get a headache and not really the worst headache of your life. So you have to have a high index of suspicion for that one. Another one that people worry about is a brain tumor. And brain tumors tend to start out, as the tumor grows in the brain, it can be a dull headache, and they don't really worry about it too much, except it doesn't go away. It's like constant. It's just always there. I never had headaches before. I've got this headache. And then often as it grows, depending on where it grows, you'll have some neurological symptom with it. Maybe your speech will be blurred, or you have double vision. I'm sorry, your speech will be slurred, or you have double vision. Or maybe you have some other neurological deficit. Maybe you're not moving an arm or a limb properly. There's something usually that goes with it. So when we see the neurological symptoms with that, we typically say, we need to get a CAT scan or an MRI. So those are the two most serious: a hemorrhage, cerebral hemorrhage, or a brain tumor. Then we have some that are interesting, like sleep apnea. People often don't realize that with sleep apnea you can get a headache, but you stop breathing from anywhere from 15 seconds to 120 seconds, and that can cause headaches, especially in the morning. So if you have morning headaches that go away later, you got to be thinking about, do I have sleep apnea? Then we have medications. Medications are a common cause of headache, and we especially if you're on a lot of medications, you got to go through the list with your provider and just sort of check these off and see if any of those could be causing a headache. If you've been banged on the head, whacked on the head, usually those concussion headaches are pretty simple because there's been an injury, and you fell or you got hit, and you really realize, okay, that I didn't have the headache until that happened. So those can last for weeks sometimes. We call them post-concussive headaches. But the two types of headaches that we see most frequently, so these other ones that are really dangerous are pretty rare. I don't want people to freak out and think they need a CAT scan because they've got a little headache right off the bat. But vascular migraines are real common, and vascular migraines are caused by dilating blood vessels on the surface of the brain. And that's typically preceded by an aura, a sense that something is happening. I'm getting a headache. I've got light sensitivity. I'm feeling nauseous. Usually these people know, they've got a history of these vascular migraines. They know, here it comes. I need my Excedrin migraine or my Imitrex or sumatriptan, whatever they're taking. So those often also are associated with nausea, vomiting, turn the lights out, cold, dark room, no noise. That's the typical treatment. Most people that have these recognize them pretty quickly. But the other, I would say probably the most common cause of headaches is tension headaches. And the tension headaches have to do with muscle tension, with your head down, with your head fixed in a certain position. It can be the trapped muscles in your shoulders that are tense because you've got your shoulders shrugged up because you're under tension, or maybe just your arm on a mouse and the lifting that arm up activates the trapezius muscle, and it can go into the neck where those muscles attach. People don't understand or realize that the muscles along your back, so if you feel your spine with your thumb, you can feel the little knobs of your vertebral column. On both sides of those, you've got these long muscles, and everybody knows what I'm talking about. Those muscles can start down at the sacrum and the hip and go all the way up into the back of your head. You've got a little knob on the back of your head. If you go right to the back of your head, you can feel this knob. It's called the occipital protuberance. that's the attachment site for these muscles. And there's a lot of muscles that attach there. And so when those muscles get tense, they can radiate pain up into the head in different places. You can also get headaches just from TMJ, from biting down. It's another tension headache in the jaw muscles in particular. And you can also feel those in the temporal muscles, which is the temporal part of your skull or your face, where those headaches can occur. But tension migraines are really common, tension headaches, and usually when I see those, I'm like, I got an easy fix for you. He's down the street. He's going to tell you that we're buddies, but I'm the weaker of the two because I don't lift hard enough in the weight room and all this other garbage. And I say, hey, tell him, this and this about him. We know this about him. But we banter back and forth all the time. But I'm so happy that he's down the street because he does an excellent job. So I'm going to have Dr. J talk about his experience with that, because this can be really, really helpful. And I think it's the most common cause of headaches.
And it is strange, I guess, maybe to think that taking care of your shoulders can relieve your headache, but that's truly the case, right?
Yeah, that's a big thing in what I do, musculoskeletal issues. And that's the key when we have patients come in is, like Dr. McKnight said, there's a lot of more serious type headaches. And that's the goal is when we first see somebody is, describe your headache to me. What's going on with your headache? Do you have other symptoms associated with your headache? Do you have numbness and tingling? Do you have dizziness with your headache? Those kind of types of things with a terrible headache maybe is referred out. But those more tension type headaches that I treat in the office are looked at in your headache is diet part of it. Because like Dr. McKnight will tell you, is pop is a huge problem. What we see, people drink pop all day long. And then if they don't get that fix, that caffeine fix, they can have headaches associated with it. One thing I notice too is because we get busy all day, you're working, I know this happens to me, is people don't drink enough water throughout the day. And tension type headaches, I find, and this is the first thing I tell people to do when they have tension type headaches, is you need to start drinking more water. Because I know what happens in my office is I have a bottle of water on my desk, I start working, you go to your desk, someone asks you a question, you kind of don't drink any water. Maybe you'll take a sip of it, and before the day's over, you drank a half a bottle of water. You're going home, and you have a terrible headache on your way home, and you just want to eat dinner and just relax. But, you want to try to drink 3 bottles of water throughout the day. The other thing we'll do is then look at mechanics. Our society nowadays, we are looking down at phones, iPads, we're at computers, and we need to look at how our ergonomics are set up at work or at home, and how our neck is involved with that. Because we could be hunched forward if our screens are too far away from us. Are they head level? Because when these type of tension builds up throughout the day, like Dr. McKnight was saying, at the top of the neck, there's a group of 3 muscles called the suboccipital muscles. And people will have tension headaches, and they'll be rubbing the back of their neck at the base of their skull, and it feels good, and their headache almost goes away when they're putting pressure on it. Well, that tells you those tension type muscles are just so tight they're causing headaches to develop. And where we see the pattern of headaches is every muscle has a referred pattern of pain. And the suboccipital muscles, the muscles at the back of your skull there, will radiate up the side of your head, sometimes into your eye, sometimes into your jaw, sometimes to your forehead. And you'll notice, boy, if I put pressure there on the back of my head, boy, my headache almost feels better. It goes away for a little bit, and then you let go, and it's back in 30 seconds. So it's very common to see that. And those are the types of things we do in my office. Is we treat those. We do a technique called active release. We stretch those muscles. We teach people how to do exercise to keep tension off those muscles. But the biggest thing is hey, I'm going to make you feel better. But unfortunately, you got to go back to work 8 hours a day, and is your ergonomics causing some of this? Are you drinking water? How much pop are you drinking every day? What's your diet like? How much sugars are you eating? Can we fix your ergonomics, do these exercises, and you could feel a lot better?
So it's water. I mean, that's a big deal.
It's a huge deal.
It can help, but it's interesting when he's talking about pop, especially caffeinated pop, because anybody who drinks a lot of caffeine and has tried to stop has had the experience of getting a migraine following this. Well, this goes back to the vascular migraines, because caffeine will constrict the blood vessels on the surface of the brain. It constricts blood vessels everywhere, and as the blood vessel then begins to dilate, that causes the pain of the vascular migraine. So what do? You drink caffeine, and it constricts it again. It doesn't hurt. Back in the 50s, if you came in the emergency room with a bad vascular migraine, the treatment was intravenous caffeine. You know, and when you take Excedrin migraine, it's really the caffeine in there that, if you get it early enough, that constricts that. So, but I think he makes a good point about the importance of hydration and eating properly. You know, there are a lot of things, monosodium glutamate, and some others that can also lead to this. I really think some of the artificial sweeteners in the diet soft drinks also are pretty toxic, and I think they can lead to headaches as well. But it's really cool for me to see somebody go see Dr. Jakubowski and come back and say, I can't believe, I didn't think there was any way this is going to get better. This migraine or this hip pain or this back pain, and in 2 or 3 visits, I'm completely pain-free. And it really is about, we talked about this every time he's here, is proper mechanics, making sure the muscles and the joints move like they're supposed to, and that they're balanced. That when one is contracting, the other muscle, the agonistic or antagonistic muscle, is stretching or relaxed. So these things are really simple, and we just hate to see people suffering with when you have a tension headache or muscle tension. You can take ibuprofen, but that's not really the cure. It's moving the muscles.
Covering it up.
Yeah, exactly. Getting the root cause and fixing it. And it's a pretty easy fix. If you've had these conditions, these tensions in your muscles and tendons for a long time, it takes a lot longer to work that out. And you've got to really be committed to daily stretching, and maybe you need to see Dr. Jakubowski a couple times a week.
Real quickly, Dr. J, there's some stretching things that you can do while you continue to work. I mean, just with neck movements and that sort of thing.
Yeah, there is. I think the biggest thing people need to do is look at their environment and find out what stress is causing this type of tension. Because most people think, I just sit at a desk all day and it's not strenuous or anything, but you have to look at where your monitor is, and that's probably better than actually any stretch you can do. Yeah. Now, there is specific stretches you can do for these types of muscles, but I think the biggest thing is finding out what mental stress and what physical stress you have that's kind of contributing to these type of headaches. And what we see too is even a pattern of just the way you sleep at night can make a huge difference on types of headaches, because a lot of people like to watch TV in bed, right? So they have like 5 pillows stuck underneath their head, and then they fall asleep while they're watching TV, and their neck's killing them in the morning. And that's a tension type headache. If you sleep on your stomach, that could be a huge problem with headaches too. So these little things you have to look at. And then we also see those things with, like he mentioned, is TMJ issues. When we see TMD develop, a dysfunction of the jaw, a lot of times, is it really the jaw or is your neck causing it? Because all those muscles are attached. So we have to look at all those stresses. And then obviously a good stretching exercise routine. And then I can't emphasize it enough, is hydration for any musculoskeletal problem is huge.
Right. So we need to say TMJ is talk to Mike Jakubowski. Is that TMJ?
Absolutely. Yes, there you go. Let's see. I think you had an extra syllable or word in there. But it's close. TMJ is close to Dr. J.
It's close. All right. Hey, thanks a lot. Very helpful. Talk to you next time. That's our talk with the docs this morning.